Canada's Health Minister Mark Holland, along with other Canadian health authorities, are failing to adhere to the science. So in today's report, I'm going to break down some of the facts so that you can make an informed choice about what you inject into your body permanently. At the end of last week, Canada's Health Minister Mark Holland, a seasoned bureaucrat and lifetime politician with no medical background, took to social media to virtue signal about the new modified RNA COVID shot formulations allegedly targeting the Omicron variant KP.2. Got my COVID-19 booster and flu shot today, he wrote, because staying up to date with your vaccines is the best way to protect yourself and your community, which is an unfounded claim since the COVID-19 shots were never studied or tested for transmission reduction. Interestingly, that clip doesn't actually show Holland receiving the vaccine, but nonetheless, he parrots the unscientific direction of receiving two vaccines at once, called concurrent dosing. The link Holland shares in his post leads to Canada's National Advisory Committee on Immunization, called NACI, and its most up-to-date recommendations, which Health Canada and the Public Health Agency of Canada take at face value, since it's supposed to be an independent advisory body with the sole responsibility of advising on vaccines. Under publications from the past 6 months, NACI shares its statement on seasonal influenza vaccine for 2024-2025, which leads to a 70-page guidance document. On page 20, it claims that all seasonal influenza vaccines, including LAIV, may be given at the same time as or at any time before or after administration of other vaccines, either live or inactivated, including COVID-19 vaccines for those aged 6 months of age and older. They include a link to refer to the COVID-19 vaccine GIC chapter, which leads to a link to the Canadian Immunization Guide. In addition to still recommending the vaccine for pregnant and breastfeeding women, a point of contention I'll come back to in a minute, there's a whole section dedicated to concurrent administration with other vaccines. The guide confirms that COVID-19 vaccines may be given concurrently, which apparently reduces barriers to the provision of routine childhood immunizations and seasonal influenza immunization. The guide confirms that studies and surveillance activities to assess the safety, immunogenicity, and effectiveness of concurrent administration of COVID-19 vaccines with other vaccines has been reassuring to date and are ongoing. Reassuring? That doesn't sound very scientific or evidence-based, but rather opinion and speculation. They confirm the lack of science surrounding this advice here. Studies on vaccine effectiveness with concurrent vaccine administration are limited to date, but suggest that effectiveness against COVID-19 influenza-related outpatient visits, emergency department visits, and hospitalizations are similar with concurrent administration compared to separate administration. Okay, so the best that Canada's vaccine advisory body can do is to suggest concurrent administration prevents doctor visits? What kind of pseudoscience nonsense is this? Well, the guide claims that there are no established safety issues associated with concurrent administration of COVID-19 vaccines with other vaccines. They counteract that statement in the very next sentence when they say that in some studies, reactogenicity, which is the adverse event profile after concurrent administration of COVID-19 vaccines and influenza vaccines, was increased compared to influenza vaccination alone, but comparable to COVID-19 vaccination alone. So increased chances of reactions are okay because it's the same as the reaction rate to COVID-19 vaccines when administered alone, which our health minister also called remarkably safe and miracles of science last year.
I really want to encourage all Canadians. I'm going to be going and getting my own vaccination tomorrow, and I think it's incredibly important that everybody gets this. This isn't a partisan issue. It is a miracle of science that we were able to find the vaccines that have saved tens of millions of lives across the planet, including hundreds and hundreds of thousands of lives here in Canada. So I really want to compel people, the new formulation that protects you against the latest variants of COVID.
Sourcing back to this guide, at least they refer to informed consent. Informed consent should include a discussion of the benefits and risks given the limited data available on administration of COVID-19 vaccines at the same time as or shortly before or after other vaccines. And the discussion should include the package insert or what is called the product monograph. That's a factual scientific document on a drug product by the manufacturer. And the manufacturer themselves say that the novel modified RNA spike protein injections were never studied or tested for concurrent administration. Look at this. Moderna's Spikevax product monograph for the Omicron KP.2 variant, last updated September 17th, 2024, confirms that the safety and efficacy of Spikevax in pregnant women have not yet been established, and that it is unknown if Spikevax is excreted in human milk. A risk to the newborn/infants cannot be excluded. Under Section 9 on page 43, drug interactions, no interaction studies have been performed. In fact, no safety or efficacy studies have been performed at all with this injection. The product monograph uses the word inferred 11 times throughout the document, meaning that the safety and efficacy assurances are based on studies from their previous product formulations. On page 4, under indications, it's the first use of the word inferred. The safety and effectiveness of Spikevax for individuals 6 months of age and older is inferred from several studies of a primary series and booster dose of Spikevax bivalent in individuals 6 months to 5 years of age, a booster dose study of Spikevax bivalent in individuals over 18 years of age, a booster dose study of Spikevax XBB 1.5 in individuals 18 years of age, as well as data from studies which evaluated the primary series and booster vaccination with Spikevax. This statement claims that the particular formulation is supported by other studies across various age groups and formulations, but those study results were just posted earlier this year and they have questionable results. In terms of Moderna, the original phase 3 study results were posted earlier this year, and I'm not sure that a product which caused grade 2 adverse events described as moderately debilitating in 39.5% of trial participants after 2 doses can be coined as safe, especially considering an astonishing record of grade 3 adverse events described as severely debilitating in 19.7% of participants, and grade 4 adverse events described as life-threatening in 14 injection receivers versus 3 in the placebo. I'm not sure that these are the kinds of results that should infer the safety of new novel formulations, and Pfizer really isn't that much better. Pfizer's KP.2 Omicron variant formulation product monograph, last revised October 25th, 2024, says that they have no data yet regarding the use of Comirnaty during pregnancy, and no data are available yet regarding the use of Comirnaty during breastfeeding. It is unknown whether Comirnaty is excreted in human milk. A risk to the newborns and infants cannot be excluded. They do say it can be administered concomitantly with seasonal inactivated influenza vaccine. Of course, the effectiveness of this is inferred from a study which evaluated non-inferiority of immune responses as compared to either vaccine alone. The Pfizer-run study had just over 1,100 trial participants who had to be established as healthy, i.e. not at high risk, and aged 18 to 64, so not at all in children, toddlers, or babies, or the very elderly. They were followed for 7 days to 1 month post-injection, so this isn't a long-term study in any sense of the word. Like the Moderna package insert, Pfizer's new formulation has the safety and efficacy inferred from studies which evaluated the primary series and booster vaccination, with various studies outlined thereafter. The actions and statements of Minister Holland, alongside the guidance from Canadian health authorities, reveal a troubling pattern of complete disregard for adequate and accurate scientific rigor. Relying on unsubstantiated assumptions, limited data, and vague inferences rather than concrete evidence when it comes to people's health is a grotesque oversight at best and deadly at worst. For Rebel News, I'm Tamara Ugolini. Call on Minister Holland to revoke market authorization for these shots at nomoreshots.ca. At that website, you can find a ton of reports on this topic that follow the actual science, and you can also support our work by signing up there. That's nomoreshots.ca.